There are many factors that will increase breast cancer risk. Some of the factors we can't change. For example, being a woman, increasing age, or having a family history. But looking at the rapid increase in breast cancer rates, we know that lifestyle changes is clearly very important. Is the reason why it's changed. When we look at Singapore, as we change from a developing to a developed nation very quickly, our rates of breast cancer has increased 3 times over the last 30 to 40 years. And in countries like Philippines, China, India, we see that the rates of breast cancer in their cities is very high compared to their rural areas. For a woman to have her first child before age 35, or breastfeed for more than 1 year, or have more children, this decreases the risk of breast cancer for her. However, because of different lifestyle expectations and maybe culture in the cities, the women are having their children later in life. They can't breastfeed for so long because they have to go back to work, and that will increase the risk of breast cancer. Also, women take external sources of estrogen, like oral contraceptive pills to delay pregnancy, and this will increase the risk of breast cancer slightly. The treatment approach is very different for benign or malignant cancers. For example, the surgery is very different. For benign cases, we only aim to make a diagnosis that this is benign and is not cancer. If it is not causing problems, we may not need to remove the lump at all. However, for benign conditions, we remove the lump if we have any doubt about it being benign or malignant, or if it's causing the patient problems like pain. However, for cancer surgery, we have to remove the tumor with a good clearance, clear margins, and we may also have to assess the lymph nodes. Nowadays, we are using more and more oncoplastic techniques. Now, because we are having a better cancer survival with better treatment, we also need to think about the aesthetic outcomes and the patient's quality of life after her breast cancer treatment. So oncoplastic techniques means combining good oncological clearance with plastic surgery techniques to achieve a good aesthetic outcome. Now, this may mean different ways of placing the incisions. It may mean partial reconstruction or full breast reconstruction. We see the breast cancer rates increase after age 30. However, it is still not high enough for us to do a widespread breast screening. So for women at age 30, we will still advise just doing breast self-examination. If they pick up any lumps or they have any breast symptoms, then they should see a doctor for further evaluation.